In this video, I'm going to answer the question, is a pain in the neck serious? And provide you with 3 things that you can do immediately to start getting some relief. And we're going to get started right now. Hi there YouTube family, I'm Dr. Craig Heinsohn, your chiropractor in Ottawa. And I love helping people solve issues that they have with their upper spine or their neck. And today I'm going to help answer the question, is a pain in the neck serious? And provide you with 3 things that you can do immediately that's going to start to give you some relief. And stick around right until the end. And I'm going to give you a little known long-term solution to give you a permanent fix for a pain in the neck. So, there are 2 medical situations where a pain in the neck can be extremely serious. The good news for you is that they are also extremely rare, so the likelihood that this is your problem is very, very small. That said, those 2 situations are a fracture of the spine and also a cancerous growth or tumor in the spine. Both these situations can be ruled out by your medical practitioner, who can use and order imaging which will allow them to get a diagnosis. Such imaging is things like a bone scan, for example. Now, the things to understand, if you have a fracture in the spine, usually something very serious in terms of physical impact has happened. So that could be a car accident is the most common, could be a sports injury, could be a fall, could be some sort of violent interaction with somebody. Okay, so in other words, the history will often dictate the likelihood of having a fracture. The situations that won't apply in is if the person has some sort of disease process under the surface. So that would be, for example, when someone has osteoporosis, or as we mentioned earlier, also if someone has a cancer in the spine, then that weakens the bones greatly. And there are some other medical conditions that can cause weakened bone. And in a situation where someone has a spinal tumor, it's extremely rare to have a spinal tumor without there having been a history of cancer elsewhere. And one of the distinguishing features of that type of problem will be unrelenting pain throughout the night. So, mostly when you have a pain in the neck, it's due to some type of chemical, physical, or emotional stress which has exceeded the body and particularly the cervical spine's ability to adapt. And that in turn leads to interference with the nerve system. The muscles then start tightening, and when the muscles tighten in the spine, and you guys will know that this is the spine, then it starts to pull the spine out of position. Okay, and then when the muscles are tight and out of balance, it can then possibly start putting pressure on these yellow things here. These are bundles of nerves. So the muscles are pulling the structure's putting pressure on the nerves, and the muscles are being pulled in the first place by the nerves. And now the structure's out, it's actually putting more pressure on the nerves. So it sets up a bit of a vicious circle. And of course, some of those nerves are going to organs, which can lead to a decrease in function all round. So the name of this process is a subluxation process. So for me, that is where we start to apply the first leg of the 3-legged stool of health recovery. Okay, so what can we do at home to reduce and slow down or reverse this subluxation process? So we use an approach of what we call the 3-legged stool. Now the leg we're going to discuss today that you can apply at home is what we call good spinal hygiene habits. So I'm going to teach you my 3 best specific spinal hygiene habits right now to relieve a pain in the neck. So the first one we're going to talk about is what we call the tummy time cervical retraining habit. Okay, now this is your spine, as we mentioned before. This is the back of your head and this is your tummy. Your legs come off down here. The top of the spine, or the cervical spine, that curve forms when you're led on the floor as a baby. You're pushing up and looking over your shoulder. So that's why it's called tummy time exercise or tummy time habit. So again, looking up and over the shoulder. And we're going to hold that as we look up and over the shoulder. We're going to hold that for 4, 3, 2, 1. And we're going to do the other side. So we're going to do it twice for 4 seconds. 3, 2, 1. Okay, so we want to be doing between 4 and 12 times a day. Now there's lots of places you can do it. You can do it when you're waiting at a red light, obviously not when you're moving, because it just takes 16 seconds. If you do it while you're waiting in the queue for shopping, you can actually even do it in the bathroom, okay? So it's just holding for 4 seconds, both sides, okay?
So this is the second stretch, the second exercise that I'm going to give you to relieve a pain in the neck. Now, you need to be able to do it with another person, so you need someone else with you. So they're obviously going to have to see this video, but basically what we're going to do is we're going to have that second person, they're going to do some cervical traction on what's called the occiput. The occiput is the bone at the back of the skull. So if you come here, you can see this area of the skull, this is called the occiput, okay? Now, this is Harvey, he's assisting me. I'm going to remove his head here so I can show you that what's going to happen is the person's going to lie down on their back. So if it's you that has the neck pain, and this is going to be yourself, you're going to lay down on the back. And the person that's assisting is going to get their fingers, these 3 fingers, basically both sides, and they're going to just hold under the occiput really gently. So the person's head will be in the hand, and then you're going to pull very gently towards you. Now you're not bending the arms and then giving it a yank, okay? You're just basically putting a little bit of weight there, as if you had, say, a 10-pound bag of potatoes and you want to just make them move towards you. So you hook your fingers there and you pull very gently, okay? And you just hold that for 5, 4, 3, 2, 1 seconds. Okay, right now I'm going to show you a demonstration with a real life person. So again, we're just going to use these parts of our fingers, and we're just going to cup it underneath the occiput, and we'll just pull them very gently. As I said before, it's as if we've got a 10-pound bag of potatoes on the bench and we're just pulling it towards us. So it's not a big yank like that, nothing like that, okay? So really simple, down there behind the occiput, and just pull them very gently, not too hard. I'm just going to hold that 5, 4, 3, 2, 1, okay, and relax there. Great. So remember also, this isn't for everybody, so if it's causing a little bit of discomfort or pain, just stop it straight away. And obviously the person that you're showing, or the person that's actually doing the traction, just start really gentle, and that's just a nice gentle pull. But you'll find that if you're holding it and you're getting it correct, that's going to feel really nice.
Okay guys, so this is the third spinal hygiene habit that I highly recommend, and it is what we call the pec minor stretch. Now watch, standing here nice and upright, I've got nice strong structure, nice strong posture. But if I'm here, is that stronger or weaker, do you think? Well, obviously I'm leaning forward, it's a lot weaker, and I've lost the core strength and the core structure, okay? Now what happens is, as we have gone from being upright, moving, hunting and fishing for 350,000 years, now for the last 200 years we've been sat down, so that's used this curve. Now for the last 50 years we've been at a computer, and the last 10 or 15 years we've been on mobile phones. So this curve is coming forward. So this is an excellent stretch. If you just slide off your shoulders there and just press in there, if it's tender, you know that that muscle is in spasm. If it's in spasm for a long time, it starts to adhere. So in other words, it starts to stick. If you have shoulder issues, then you may have a little difficulty getting up. But this is how it goes. So just be careful, be mindful of what you're doing. If you have some sort of restriction, be mindful of that, note it down, and don't stretch yourself, don't hurt yourself. So first stretch, we're going to come up here. Now the elbow, there are 3 things to remember. 1 elbow, 2 feet, 3 head. Okay, so the elbow needs to be here 135 degrees, not 90 degrees. It's not like a pec deck in the gym. It's actually higher, 135 degrees. My body's basically perpendicular, level to the door, and the next thing I do, number 2, is feet. So I'm turning my feet. This is 90 degrees from my arm. This is 135. I need to be 135 degrees, okay? As I come around now, I feel that stretch coming through. Okay, I feel that stretch on the pec minor muscle. Then the third thing I do is I turn the head. And I'm going to hold that for between 10 and 30 seconds. This is a nice stretch to open up the chest. It's obviously you need to take it as far as you can for yourself. If you do have shoulder issues, it's actually a good exercise for just monitoring your returning range of motion when you start to get traction on recovery. Okay? Do the other side. Always do both sides. If one side is stronger than the other, start with the stronger side, okay? So number 1, arm, number 2, feet, then number 3, head. If I want a little more pressure, and I'll turn around so I can show you. If I want a little more pressure on my muscle here, I basically lean forward in that direction. So if you imagine there's an arrow from this pec muscle going forward, I just kind of follow the arrow. So I just push the weight of my body that direction, and then that really enhances that stretch. Okay? I hope you enjoyed those 3 stretches, and I promised I was going to give you more information to get more of a long-term permanent fix for pain in the neck type issues. So remember I mentioned earlier, I employ a 3-legged stool to get results. So what we do to get the permanent fix is we apply the other 2 legs. The first leg is what we call adjustments in rhythm. So I work as a chiropractor, we work to remove these subluxations. And then that allows the body to move more fully, so you get a better result with the other 2 legs. And then the third leg is about adopting loving habits. What that means is adopting loving habits in the area of food, movement, thought, and rest. Okay, and these are 4 pillars that we use, and on our sister channel it's a wellness channel that covers adopting loving habits. So I'll put links to that sister channel down below. There's a playlist on pain in the neck type issues, so click on that now, go and check that out, and there's lots of other great information for you. And if you have any comments or questions, just post those down below and I will circle back and answer them. And also, if you've enjoyed the content on this channel, then please consider subscribing. We'd love to have you as one of our family members.